The Executive Director of the Ohio Alliance to End Sexual Violence. Pronouns are she, her, and hers. And we are here this morning with Camille Crary. Camille, if you would be kind enough to introduce yourself.
Absolutely. Good morning. I am Camille Crary. I'm the Director of Legal Services and Policy at OAESV. My pronouns are she, her, hers, and this is my first time using Facebook Live, so I'm really excited.
Excellent. So we are going to engage in a series of conversations, critical conversations with our community partners, our regional directors, our rape crisis centers, talking every Wednesday morning at 8:30 in the morning through Facebook Live about the impact of not only COVID, but actually VOCA and the cuts of VOCA within the state of Ohio and what that does implicate and indicate to each and every one of the survivors we serve, as well as advocates and the communities as a large. But before we enter into VOCA, Camille, I did want to talk to our member-based agencies and to those that are seeing us today about what the coalition is and what is it that we do, because there's a lot of misunderstanding, right? Not only by funders, but by philanthropists that want to donate to sexual violence, to end sexual violence, to prevention, to the cost, and don't understand the dynamics of a coalition. So I'm going to take a few minutes to actually talk about the coalition, and then we'll talk about VOCA and the states. But every state in the United States has a designated coalition. And the designation is by the Department of Justice that is done, indicating that in that state they actually do work with either rape crisis center, domestic violence. There are 11 states that have individual agencies, and Ohio is one. So we have a domestic violence coalition, and we also have a sexual assault coalition. But the work of the coalition is at a macro level, and we are different than the local rape crisis centers because every coalition is able to go ahead and engage at the macro level, organizational training, advocacy, policy advocacy as well, that the local rape crisis centers are not able to go ahead and do. We also advocate for all of the funding, for all of the programs within the state of Ohio, but we also have a voice at the national level, and it's important to actually have those to understand those distinguishments. So we are here to share information about best practices at a statewide level, to collaborate, to strengthen policies and leverage resources to meet the needs of survivors, to seek to foster community safety and well-being, to end isolation of survivors and agencies working on their behalf, to improve services and response to survivors and to all impacted by sexual violence, to improve and increase public awareness about sexual violence, to eradicate sexual violence, and to inform and shape public policy. But once again, at a micro level, right? So every effort that we do is not only conform and to benefit the 17 members of our team, or the Ohio Alliance as a whole. It's actually to benefit currently the 33 rape crisis centers around the state of Ohio, and to ensure that over 20,000 survivors within the state of Ohio of sexual violence, interpersonal violence, have an organization that will have their voice, their back, that will empower them to participate in different venues. We are a member-based agency, which means that all of the 32 rape crisis centers around the state of Ohio, 33 now, are members of the organization, that they receive our technical assistance, our trainings, that they participate in any engagement of the shaping of the public policy. And we are positioned to strategically amplify the efforts of all of the rape crisis centers within the state of Ohio. And it's so important that people understand that. So when whenever there is a contribution made to the organization, it trickles down to what are the actual core needs of the individual rape crisis centers, and how can we go ahead and suffice those needs. And 88 cents of every dollar that is contributed to this organization goes directly to programmatic, and to training. So we provide the court standards within the state of Ohio to ensure that the programs are meeting the standards, and once again, just advocating at the statewide level in order for them to be a streamline of funding. As we know, times have changed, and we have found ourselves, for the last 2 years, 2 cycles, in a decline of VOCA and VOCA funding, which is one of the heaviest funding streams of not only this coalition, every coalition around the nation, but also the local rape crisis center, as many of us are heavily state and federally funded. Camille, tell us a little bit more about VOCA, and what does it actually represent and do, and what's going on, what has been going on for the last 2 years?
Absolutely. So VOCA is very unique as a funding stream. So as Rosa mentioned, the majority of rape crisis programs, crime victim services overall, across the country receive the majority of their funding from the Victims of Crime Fund. So this fund was designated in the 1980s as a federal funding stream to provide support to victims of crime. And what's really unique about it is that it is not taxpayer based. So that's a really important distinction. This fund is administered by the DOJ, their Office on Victims of Crime, and the money that comes in is actually comprised of specific criminal fines, bail bond forfeitures, conviction assessments, and other damages from cases that are pursued in federal court by the DOJ. So the vast majority of those are going to be high profile fraud cases, and things that are processed through federal court. They're not happening from fines that are coming in from state court cases that involve violations of the Ohio Revised Code. It's federal law. And so this has served as the backbone funding stream for rape crisis centers in Ohio and everywhere across the country for many, many decades, for 3.5 decades specifically. And so this has been something that we've been allowed to examine and understand and see as a critical funding stream. What is difficult is when the president's budget comes out, Congress and the executive branch, obviously, just like how we do it in the state of Ohio, they go through, they analyze the needs, they analyze the source of funding that they have, and sometimes they have to make cuts in what they are distributing from this fund based on what has come in from these fines and other sources. So in the past 2 cycles, the federal government has had to reduce the amount that's being dispersed. And it's a little bit, if I had a big chart, it would be very full with different players. I don't have a big chart today. Every state does this a little bit differently, but in Ohio, the Attorney General receives a bulk amount of VOCA funding, and then crime victim service programs apply to the Attorney General's office in Ohio, and they decide how to distribute that funding in Ohio. What happened a year and a half ago approximately is that there was a 7% cut from the federal fund disbursement, which affected various programs in Ohio in various different capacities. But what we had to support our programs through was, how do we make up for that 7% of your biggest funding stream? And 7%, a single digit, sounds like a small number, but it's really not when that is the main funding source. Mm-hmm. And so we were able to use the Rape Crisis Center's line item to mitigate that loss when it was just 7%. We had gotten an increase to over $4 million per fiscal year, but now we're facing something much more dramatic. So this year, the VOCA cuts range from 22 to 48%, impacting programs in a very unprecedented way. So as this fund was created for victim services and programs have integrated that into their budget and their fundraising and their planning, this has become a solid funding source that has abruptly basically pulled the rug out from under programs. So as the federal reduction in funds going into the fund has decreased, so has our ability to support victims of sexual violence and other crimes across the country.
Thank you, Camille. And it's important to notate, right? So this was a huge effort for the past 3 years in reference to a huge increase that VOCA received, right? Before 2016, 2017. So, and all of the programs were working in reference to that increase. Ohio has been very responsible in its utilization of those fundings. And the fundings go anywhere from not only sexual violence, domestic violence, interpersonal, youth, runaway youth, human trafficking, prosecutor-based agencies, the adult also system, the child advocacy. So there's over 356 programs that actually apply for these funding. So we were at a statewide budget of $111 million. And this year, that actually declined to $55 million. So to be able to distribute, even though all of these programs actually applied, only 173 programs actually received continuous funding, even at that cut. And when you mention anywhere from 22 to 43%, there were some programs that were actually cut at a 53%. When you look at all of the other components of the cuts, because they might have had multiple grants within VOCA, there were other programs that were not funded at all. So currently in Ohio, out of the 33 rape crisis centers, we are able to cover 77 counties. We still have 11 counties to go. And we had asked for the past 2 years an increase in our rape crisis funding, which is a line item within our governor's budget. And Camille, tell us a little bit more about the rape crisis funding and how are we able to advocate for that? And as we're moving into this new session, also how we are also moving forward in advocating, because with those cuts, as I mentioned, from 111 million to 55 million for the state of Ohio, and not all of the programs receiving, it equates for rape crisis centers close to $9.7 million that they are not receiving this current year to be able to support survivors and to do the work from an advocacy perspective and programmatics perspective. So they have been having to utilize the rape crisis funding to supplement some of the operational and advocacy costs, and why we need to go ahead and have a second push and a higher ask, even in the midst of COVID.
Great, absolutely. So the Rape Crisis Center's line item was born around 2011. There are several states around the country that had a non-restrictive budget allocation from their state government that they could use. And unrestricted means essentially you can use it for whatever purpose your program needs it to be used for. So VOCA funding and Violence Against Women Act funding and other foundation grants, a little bit less so with foundation grants, but they have very specific rules about how you can use the funding, and you have to apply in a very narrow way. So you cannot necessarily easily shift what you're using the funding you were given for at any point, depending on the circumstances. So we are accountable for the grant funding in various, very specific ways. And so if there is a situation where you have a budget cut or donations drop, or you have an increased need, or you need to move offices, you can't necessarily use VOCA funding to cover an increase in rent for your office space that survivors visit, because that money has to be allocated to personnel expenses. So that's just one example of that. So the line item was advocated for rigorously by the coalition and the rape crisis programs, working with lawmakers, and our lobbyist, our firm Capital Partners, did a bunch of work on that as well. And they created this non-restrictive line item that could be used for sexual violence prevention education, because there is minimal funding across the board available specifically for that. And also for advocacy expenses. And like we said, anything that a rape crisis center needs to keep its doors open and its services available to the public that they are serving, the constituents that need those services. So that line item was first introduced at just under $1 million in the first General Assembly budget. It increased to 1.5, but what we were finding was that we had kind of a big increase in services at first. And so one of the things that we were advocating for was, at the time that we started advocating, we had rape crisis services available in less than half of Ohio's counties. And we conveyed to the lawmakers that if you want services in all 88 counties, which you should want, because it is not appropriate to have your available services be dictated by which county you happen to live in, we conveyed that the easiest way to expand services, or the most efficient way rather to expand services, was to add funding to pre-existing programs that were willing to expand in adjacent counties, rather than starting from scratch, which we sometimes do and sometimes works out beautifully. But our goal was to increase that with programs that were already solid and had a great foundation of meeting core standards. So what this fund also did was we created core rape crisis center standards that, to receive the funding, the Rape Crisis Center has to provide those services to the survivors that seek them. And so we wanted to create high quality, uniform services where we knew what was available in every program that we are saying is a designated rape crisis center that receives this funding. So we have core standards OAESV developed with the Attorney General's office and several stakeholders. And we provide 40 hours of training. We have a lot of different competencies and provisions that have to be provided. So with that, with the first few years, we were able to expand to over 70 counties. It was getting really successful, but we hit a stagnant point where we were not able to continue expanding because VOCA federal cuts were coming into play in various ways. And we just needed another push to really increase to 88. So our goal with getting the increase, we asked for an 100% increase, we got a 227% increase last GA, was to establish services in all 88 counties. But with the funding cuts that have consistently come in, we have had to use that money to sustain services that already exist. So right now, as Rosa mentioned, this VOCA cut could wipe out services in entire counties. Yes. And so this funding stream needs to be increased, because without that, we might find ourselves back where we were in 2013 with the less than half. And I know that sounds dramatic, but it is dramatic. We lost a lot of money. So with that, I do want to kind of give some tips. And every first Friday of the month, we do a webinar. So this Friday at 1 p.m. Eastern time, I will be doing a webinar with my colleagues, and we will be sharing information about how you can advocate directly to your lawmaker, and ways that you can engage other community stakeholders in this process. So we recommend focusing on what services your agency provides and what will be lost, just as a core message. You know, what's going to be lost if this is not increased. So one of the things that I recommend as a tip is to just explain what community-based rape crisis programming is, because there are many different services that are funded by the Attorney General's office that do really innovative work, and some of them are based in prosecutor offices, some are in law enforcement offices, some are in hospitals, some are at campuses, and some are in these individual community-based rape crisis programs, and that is what the line item funds. So the role of a community-based advocate is unique in that it empowers the survivor. So they are the only person who is employed specifically to empower the survivor to seek healing and resources. And other professionals that are involved, like prosecutors or judges or police officers or hospital professionals, all have different codes of ethics they have to follow. And advocates also have a code of ethics they have to follow. But when you look at a job description, so I'm an attorney and I often talk about how civil lawyers differ from criminal lawyers, and we all have different things that we are primarily focused on. But a lot of the players that are involved that interact with survivors have an ethical obligation to a different party other than the survivor. And so everyone really that we talk to, that we work with and collaborate with, really values having the advocate, because when there is an advocate whose role is specifically to advocate for that survivor, then the prosecutor, law enforcement, hospital, they're not put in a position where they have to adhere to their ethical standards and then also advocate for the survivor, because sometimes those standards conflict. And so talking about what that is and just identifying that service and the importance of that service is a really critical piece of advocating, just as an introduction. And I will
Definitely. And understanding that, right, the healing process for survivors are totally different, and also understanding the dynamics of and composition of your community, and being a voice especially to the marginalized, to the underserved, LGBTQI community, brown, black, the migrant community, farmers. Who is in your community, right, and who is it that you're supporting and ensuring that you're not having them walk through a system that is not there necessarily for the process that they need at that moment, but understanding that you are there to amplify their voices, to believe, support, and being there. And lawmakers need to hear that and understand how important that neutral service and community-based services, especially for the healing process of survivors, and to hear their voices.
absolutely, thank you. It's totally important, and lawmakers are excited generally that this is available if they aren't familiar with it when they learn about it. And so it's also helpful for their constituents, because in addition to passing legislation, lawmakers are also representatives that provide information and referrals through their office to a number of social services for constituents who need them. And so we've worked with a lot of lawmaker aides whose offices are reached for referral to a rape crisis service, and then we're able to provide that referral. So it's something that is useful for their constituents as well. So overall, it's a really positive conversation to have. And we recommend sharing the direct impact. If you are able to share how many employees will be lost, how many services will be lost if you're going to have to cut your prevention program, talk about what prevention is, why it's critical, why it's important. OAESV over the past few years has had, and I'm not exaggerating, we have had hundreds of legislative meetings about budgets, about legislation, about all kinds of things. And we always counter or kind of center our meetings around this: what is a rape crisis program and why am I here talking to you and asking you to do this? And so we talk about prevention, we talk about advocacy, we've given them some information. So they have generally a little bit of background, but it's helpful for you to explain the benefit. There will be a lot of follow-up questions about specific losses, though, generally speaking. And so it's important to be able to do that. And my biggest tip, and I think this is a key to being really effective, when they ask follow-up questions, it's okay if you don't have the answer, but make sure that you do follow up. They really appreciate it. I've had lots of people during the last budget, I hand delivered a packet to all the senators with like a compilation of all the questions they'd all asked. And more than one aide said, most people never respond, never follow up, don't really care, or not necessarily don't care, but they don't have time or don't think that we care about the content of that conversation. And so it's really important to follow up. We recommend talking to your local resources and stakeholders as well, because like we were talking about, the presence of a community-based advocacy program is beneficial to lots of people. It is beneficial to survivors, but it also helps, like I said, law enforcement, prosecutors, hospitals, other community resources, because it takes a very important part of victim services that might conflict with their own ethical obligations off of their plate. And so I've had many, many conversations with prosecutor-based associations around the country for various questions and things. And a lot of them have been so thankful for the advocates that they do work with, because like they say, I need to focus on prosecuting this case. I have lots and lots of obligations, and I may not have the capacity or ethical ability to help them with this other situation that they need assistance with. And so having that community-based advocate be there to provide that holistic support, it helps everyone do their job better, and it makes sure that a survivor does have that support that they need. So
Definitely. So thank you, Camille, for that explanation. So next week, these conversations are going to be short and sweet, but to the point. Next week, we will have some of our regional directors here talking about the effect of those cuts of VOCA within their program. You know, and we recognize that COVID threw everything off, right? And that we're in the midst of a pandemic and that it is affecting. But the reality is that when we compound COVID cuts, the civil unrest that this nation and this state is in, there's a lot of layers, right, that actually do affect survivors, and that not every survivor is safe at home, that we have had to refigure out how is it that we're providing advocacy in the midst of COVID-19. And we're going to have those conversations for the next 2 months or so that people can get engaged and understand the trauma that survivors of sexual violence actually are affected by in the midst of COVID and continue to be, and how essential advocates are, how essential in the midst of this pandemia our programs are for the mental well-being of survivors and for this work in Ohio. So a lot of the funding needed, as we also did a survey around the state of Ohio, is, you know, communications. People need to communicate. Technology to provide e-signature and e-filing. There's a lot of our programs that not 100% are still in force within coming to person, or even our funders, most of them are still working from home. So being able to sign agreements or community engagements, hospital advocacy training and resource production in reference to videos, and how do you provide that from a tele-advocacy perspective, housing support for survivors who are isolated at home, and many are isolated still with their abusers, right? Parents that have jobs, but at the same time, their children are also having school remotely. How do you continue to navigate those dynamics in the event that you cannot get to work? Housing support for people being turned away from shelters due to COVID-19 concerns. We are advocating work phone service, tablets, Wi-Fi. Wi-Fi is a luxury. Hotspots, it's a luxury. It is not supported in every area. Phones and prepaid cell phones meant for survivors in marginalized communities, in rural communities, in areas that there still is not a tower. Securing staffing for programs serving communities of color, interpreting services, these systems of Zoom and other forms of communication, culture-specific, free mental health access for advocates, for preventionists, for counselors themselves, and also for survivors, and being able to do this in a remote format because COVID is still here, right? And it still continues to affect. So we thank you all for your time with us today. We hope that you continue to engage with us every Wednesday at 8:30 in the morning, Facebook Live, through OAESV Facebook. You'll also be able to watch these videos on our YouTube channel. So I hope that you do engage in the conversation. And for those of you that are asking what to do, call your legislators. What to do, participate and volunteer at your local rape crisis center. What to do, any amount helps. So $5, 10, 15, 20, and I know we're all in the midst of a lot of crisis and navigating, but support your local rape crisis center and support the organizations that are supporting survivors. Every little help, every little bit of help goes a long way, and it will be utilized for a great cause. Together and in community, we can't eliminate sexual violence in the state of Ohio. So thank you for your time. Hope to see you all next week.